And if you look at Bitcoin as a pure play, the return on investor capital on average for the last, since inception has been 55 to 60%, right? How do you beat that? You either have to have that involvement in a hyper growth area that's growing at 100, 200% a year and be a large portion of that. And you need to be able to grow quickly enough and position yourself in a space where you can actually capture that, right? And if you can't, then you default to effectively putting Bitcoin on your balance sheet. And when you look at what we managed to do in the last year or so since having it on, it's outperformed everything else you're doing in terms of the revenue generation, in terms of return on capital.
Hey mate, how you doing?
Yeah, I'm not too bad, thanks, Jordan. How are you? You okay?
Yeah, very good. Very good. It's good to have you on the show. Because we've chatted for a wee bit, and then you've been on some of the town halls as well. And now we can actually get to record a podcast.
Yeah, really excited for it. I'm looking forward to it as well.
Yeah, me too, man. Because a lot of people won't have maybe not come across you or what you're doing or where you work. So I think this will be new for a lot of people listening in, and also it'll shift people's perspective on what type of companies are looking into Bitcoin and holding Bitcoin on their balance sheet. So yeah, I think this one's teed up to be a very, very good one.
Yeah, I hope so.
But yeah, no pressure. No, I've talked to you before, and I know it's going to be a good one. So. So for the listeners, can you just give a little bit of a backstory around you, and then we'll go into Northern Health after that.
Yeah, of course. My name's Fahim. I'm a GP. So for people outside the UK, that's a family doctor. I qualified in 2014, which seems like a long, long time ago now. And after I qualified for a couple of years, I did a master's in global healthcare, medical ethics and law. And my focus was on global healthcare policy in response to pandemics, which was quite interesting because it was about 3 or 4 years prior to the COVID pandemic. So really, really interesting. I gained a lot of insights, and a lot of my predictions kind of came true during the pandemic as well, with regards to governments not really being able to manage a pandemic and, lockdowns and things. So really interesting.
Wow.
Then I did my GP training, which took about 3 years, and qualified as a GP in 2019. And in 2020, I became a partner where I'm working in my current GP practice. So I work there 3.5 days a week, which has been challenging, but interesting as well. And then in 2021, I became a director and a partner in Northern Health, which is a private healthcare company that's got 3 main focuses. The first is in providing staff to urgent treatment centres and emergency departments, so working with local hospital trusts to do that. The second is launching a private healthcare service, which is direct to consumer. And the third, which started off this year, was actually having Bitcoin as a balance sheet reserve asset for our business, which is an interesting step. And we could talk about that really if you want to go into it.
We will definitely be talking about that.
Yeah.
But there's a lot I want to pack in there. I didn't realize that you, 3 years before the pandemic, that you were actually researching. What was it? Can you dig into that a little bit? Researching the response to a pandemic.
Yeah. So I did a thesis, which is about 15,000 words and lots of deep research at the time, which was on the World Health Organization, how they position themselves in the world, how reporting agencies across different countries actually log and look at healthcare data and say what triggers has to happen with a virus or with a viral infection or with an outbreak to trigger some kind of response, so that they report to the World Health Organization. The next step is World Health Organization collects data from these agencies, and then they do something they class something as a public health emergency of international concern, or PHEIC. And prior to me writing that, I think they declared about 4 or 5 public health emergencies of international concern, and one of them was at the time was Ebola, the Ebola outbreak. And effectively, the problem with global healthcare is it's fragmented. So different countries that are well-funded will have really good reporting. They will collect data really well. They've got auditing teams. They'll be very on it with how they report to the World Health Organization. And other countries that are not kind of prioritizing that will actually have very, very poor reporting, because they're not actually auditing or logging or seeing where people are traveling or what symptoms are of a condition. And naturally, then what you get is a variance of information going to the World Health Organization. So it's actually unable to really coordinate responses on a global level, because you've also got to have, working with intergovernmental and government agencies in order to shape policy and say, okay, should we halt travel, or what measures should we put in place in terms of public health to prevent a disease outbreaking? So I remember at the end of it, I'd looked into it, and I was actually quite alarmed by the variance amongst countries. And actually, my conclusion at the end of it was that it was one or two lines, and it was, should there be a global pandemic, the world is ill prepared to be able to deal with the fallout from that. And actually, you can see that play out in real time when COVID hit, because it was around about September, October time in 2019 when you had the first kind of news from China. And we were hearing it, but it was on, BBC News and Sky News, and you're reading the articles and you're thinking, oh, this is far away, it's not going to affect me. But you had people coming in the spheres of those industries saying, look, this is quite concerning. This has features of something that's called a public health emergency of international concern. I think the World Health Organization was quite delayed in reporting that. So it was around about February, March time that they announced it. And that's when we had the lockdowns in this country and across the world, which is actually, no, this is something quite serious, and we need to take it more seriously. So really interesting, because at the time I was sat there at home watching it play out, thinking, "Oh, this is interesting." And I dug up my old research paper. I was showing my wife. I said, "This is quite interesting." She said, "This is boring. What he's talking to me about?" I was like,
"But look, I wrote this. This was going to happen."
You're the only person I could talk to because I'm locked down in this house. So yeah, it was very interesting. Yeah.
Oh wow, that's so interesting. Yeah, that's really interesting that it you looked into all that and then in such a short space of time, actually, you could see it. You could see it happening around what you'd written.
And on top of that, I was working the front line. So I was, as a GP at the time, I remember when it broke out, the rules were, okay, you have to come to the practice, but everything's a telephone consultation. You have to wear a mask. You can't interact with anyone in the staff room. When I was working in the emergency department, it was essentially the same thing. You have certain rules, and you're just watching the flow of patients just go down. I mean, we were only seeing about 4 or 5 people face to face for the first 3 or 4 months, even in the emergency departments, because people just weren't coming in because they were terrified, right? And then obviously that shaped the way health has changed since then. We're now predominantly general practices in the UK are doing telephone triage first. They do video consultations. There's a bit of backlash because people genuinely want to be seen by a doctor. So obviously how you manage that as a practice has ramifications as well for how successful you are at kind of managing that population. But really fascinating time. Yeah.
It is. And what's your view on that? On having that being a GP, having that physical interaction with someone versus the virtual?
For me, I've always preferred physical, and me and my partners have always said in the practice, wherever possible, it's going to be physical. We're going to see people. We believe the outcomes are better when you're seeing us face to face. Other practices operate differently, and now you have to go through a triage system where effectively an algorithm or a receptionist will say what you can and can't see. We've kind of fought back against that, and we said, well, look, it doesn't matter. If you want an appointment, you will be seen. If it's for depression or low mood, and if other practices say we don't want to see you, we're just saying, look, with open arms, come and see us. We'd rather interact with you. We get more of a sense of what's wrong with you when we can see you in person. You can really open up to us. It's difficult over a screen. It's always better in person. And on top of that, a history is a clinically part of your assessment of a patient, but the other thing is examination, is confirmation, isn't it? So we really need to get our hands on you to decide what we're doing. And there can always be a delay if you're taking the approach where you're saying, well, we'll take the history first, we'll do the bloods and investigations, and then we'll see you if we need to. We always take the approach to do both at the same time, examine the patient, see them, and decide what to do. And we feel as though the outcomes are better. Like our patient satisfaction scores in our practice are really good. Feedback we get is really good as well. Complaint levels are lower. You don't get that. You don't get the same kind of fallout or response. I mean, I see it from the other side because I work in the emergency department. So I see people come in frustrated saying, look, we can't see our GP. We've only come here because we can't see them. And we're there saying, well, we can't do anything here either because we're not equipped to deal with your case, which is a chronic disease, right? So when you see it from both sides, it gives you confirmation that it's better to see people face to face. And even during the pandemic, we were fairly quick to kind of relax the rules and say, look, actually, just wear a mask and come and see us, right? It's not a problem. Yeah.
Yeah. And I think that it goes for a lot of things in life now as well, of just face to face and anything. Because we're kind of seeing that as well. With just because you're on endless video calls and work calls, and it feels like the pendulum went really far into what digital sphere, and now it's like coming back a little, and lots of people are wanting to get back in the office a little bit more. And like, I always choose for an in-person meeting if someone's based in London.
Yeah.
um, and yeah, it does feel like we're coming back a little bit more
Yeah.
towards that physical interaction.
Yeah. I mean, COVID was an accelerant, right? And it had almost a slingshot effect. Effectively, it shot one way so far, and then people realized actually it's gone too far. And okay, the benefit of it was almost a test run into what works in society if everything's truly digital, right? So it gave everyone a sense of what can we and what can't we do. Many people took the opportunity to say, well, we'll just go fully digital, and then other people realize actually productivity is not as good, and it's better to have you get more engagement face to face, the old school way, and you realize actually we probably need a hybrid approach.
Yeah, 100%. Can you dig into a little bit around, like what Northern Health is
Yeah.
and what you do?
Yeah.
And then we'll get into the Bitcoin-y bit after.
Yeah, of course. Yeah, so Northern Health. So his business set up in 2015. A local hospital trust was being downgraded from an emergency department to an urgent care. So urgent care is effectively a walk-in centre where you're walking with a minor health problem. You can get seen there and then by a doctor. If you have something like a broken bone, you can get it x-rayed and seen by nurse practitioners. If it's something significant like a heart attack or a stroke, then you get sent to the main hospital, right? It's still based in a hospital setting though, so we get a combination of different presentations, kind of more acute than you'd see in your kind of clinic, but also on the spectrum of still manageable, unless someone comes in with a cardiac arrest, which they still do because they think it's A&E, right? Because it's because the signs are still red. It says urgent treatment, so people think urgent treatment is I'm dying, I'll go there, right? So I've had a battle with the hospital saying, look, we need to make it blue and we need to write a minor walk-in centre, but we're not getting anywhere with that. So no, in essence, what we do is we when the trust got downgraded, they needed continuity of staff and they needed it to be run by general practitioners. So business was born out of that, which then provide doctors to work in the hospital setting and a couple of local A&E departments as well. So for the last kind of up until I came on board in 2020, 21, the business was stagnant, but still making a profit, but not really growing. So then the brief was, okay, you guys are coming on board, 2 or 3 of you doctors who work here, we know what your qualities are, and we know what we think you can drive the business forward, right? So we came on board and we said, what do we need to do in order to drive it forward? In hindsight, the most obvious thing would have been put Bitcoin on your balance sheet there and then, right? But it's a wonderful thing, yeah, because it's outperformed everything. But what we said was, look, we'll use a profit from the business to generate effectively go from a B2B model, which is us providing services to the hospital, to B2C, which is us providing consultation to patients. So, set up a website, gone through the frameworks, got the registration from the Care Quality Commission, who oversee regulation in the UK. So that's been set up, and now we're on the phase of where we're marketing, saying, right, how can we get this product up and running? And there's still lots of things that are interesting with that, and we'll come on to with the AI stuff as well. The other part of the business that we said was, okay, we've got 2 pillars, and what's the third? The third is we've got a large cash position, and what are we doing with that, and how are we valuing our business? What are the metrics we're using to kind of judge whether we're successful or not, right? It's not just making the profit, it's actually what are you doing with that profit, how are you preserving your purchasing power over time? So I was looking into metrics, and in terms of return on invested capital, that was an interesting one that I came across. There was actually talk on it afterwards by someone at one of the Bitcoin conferences. I think it was from Vanguard. I think it was. There's an 18-minute video on YouTube, and he talked about how you should judge your business and when you should think about deploying capital into Bitcoin. Very interesting. But the way in which you view it is you look at the operations of your business and you say, well, with all the money that we're investing into it, what's our return on the capital that's invested? And if you look at Bitcoin as a pure play, the return on invested capital on average for the last, since inception has been 55 to 60%, right? How do you beat that? You either have to have involvement in a hyper growth area that's growing 100, 200% a year and be a large portion of that. And you need to be able to grow quickly enough, position yourself in a space where you can actually capture that, right? And if you can't, then you default to effectively putting Bitcoin on your balance sheet. And when you look at what we've managed to do in the last year or so since having it on, it's outperformed everything else you're doing in terms of the revenue generation, in terms of return on capital. So then it really makes you think, well, actually, I'm sat here and I'm doing strategy work. I'm working like 30 hours a week on building a private clinic. And it's really slow to pick up revenue and get patients through the door. And we're working and working and working and working. And where are we getting, right? Meanwhile, Bitcoin's run from like £45,000 to 86, and you're like, I should have just bought that in the first place, right? And it really makes you reevaluate what you're doing with that capital. And one way of looking at it is saying, okay, we're putting real work in and we're making a real business that's going to generate real return. But then the other way of looking at it is, well, the real work has been done by understanding what Bitcoin is now in a foundational understanding of everything, all of this multidisciplinary approach, right? You understand politics, you understand money, you understand history, you understand game theory, you understand Bitcoin, right? That within itself is work that has taken 10,000 hours to get to. And it's effectively leveraging that in order to put it into your business and say, well, I've got the conviction there. What's the barrier? The barrier is actually how my partner's aligned with me, right? And then when I spoke to them, 4 of them already had Bitcoin anyway. So I was like, why have we never spoken about Bitcoin before, right? Like you realize that you're all the crazy ones in the room wearing the tin hats, right? And then you just realize, okay, we're all on the same page. Let's just put it on our balance sheet. So we had a board of directors meeting, and we had like a presentation where I went through a few things with them, and effectively orange business pilled them into saying, right, let's put it on the balance sheet and just see how it goes. And what's our risk strategy? How often are we going to deploy it? What are we going to put on? How long are we going to keep it in? And I remember watching a video, I think it was 2-3 years ago, Preston Pish's podcast. He mentioned, there's a snippet in a podcast, I can't remember which one it was, but he mentioned, and he said, someone has asked me, what am I going to do with the Bitcoin? And I remember his answer was saying, well, look, I'm going to hold the Bitcoin and hold the Bitcoin. And then all of a sudden, when you realize that Bitcoin's rate of return is declining as it grows in size, which is inevitable, right? Once you can start to justify divesting into a business that's growing faster to it, then you can do that, right? So effectively, it's holding the Bitcoin as long as possible until effectively the system starts to become entrenched in it, and then all of a sudden businesses start to grow and they can become capitalized in that, and you can then start to say, okay, we can really jump ship and we can start to do something that's growing faster than Bitcoin with a fair degree of confidence. But for now, that's not going to happen for the next 10, 15 years, is it? So, yeah.
It's so interesting. And it's because I was speaking to someone yesterday about this, and it was something very similar. And we brought Ego Death Capital came
All
up,
right. Yeah.
and that's
Yeah.
Preston,
Yeah, I've
Jeff,
heard of them. Yeah.
Lynn. There's a whole group of
Yeah.
them, and yeah, they essentially have identified that like the only way to potentially beat Bitcoin
Yeah.
is by investing in these Bitcoin companies or companies that are creating value,
Value. Yeah.
um,
Yeah.
but are running on a Bitcoin standard essentially or a
100%.
Bitcoin strategy.
Yeah.
And that's where they deploy all of their capital.
Yeah.
And
Yeah.
it's very similar to like what you've got as well. It's like you've seen this rocket ship that is Bitcoin that,
Yeah.
and it's essentially just bolting your business onto that.
Yeah.
And then, yeah, just continue accumulating, which then you can create more value into the real world.
Of course, and I think I'm going to say I say the only barrier was are we all aligned in terms of come aboard? Actually, the other barrier was the industry we're in, right? So we're in healthcare, okay? So healthcare is generally a very very conservative field. I'm not talking about your healthcare growths that you get in America. I'm talking about like primary healthcare and healthcare services direct to patients in the UK, right? They're generally very traditional. The kind of line of thinking from people in those areas is conservative, and it's okay. Let's build a business that's a successful model that's been run before. We'll effectively copy the strategy of other businesses and do the same thing, right? And then there's always the line of thinking of, okay, what's our fiduciary responsibility with regards to the hospital trust we've got a contract with, okay? If we put 100% Bitcoin on our balance sheet and it's fluctuating and then we can't pay the doctors that we're employing, obviously that's not responsible, right? That's very irresponsible. So our risk strategy has to be very, very well thought out with actually we can't just go all in with it because we've got this expenditure that needs to have some sort of stable point of reference, right? Which is effectively fiat, right? But you can say, okay, there's a certain amount in there that will that'll pay the wages for the doctors that are working for you, and then with a portion of the rest is what you use, and you split that to say, okay, what portion are we putting towards building our clinic? What portion are we putting towards putting Bitcoin on the balance sheet? The Bitcoin on the balance sheet grows, that then enables you to expand in a way you wouldn't have been able to. So, for example, instead of just running an online clinic, how are we then able to say, okay, we're going to transition to a face-to-face model? We can buy a clinic setting, we can upgrade our offices, we can actually then expand, we can grow to then get in VC and private equity, etc. And you can just position yourself in a way that it primes you for growth. Yeah.
Yeah, and it is a cheat code essentially,
It's a
and
cheat code, yeah.
and like and that's what I don't know if Peter McCormack coined it or whatever,
Yeah.
but now that's his conference. Yeah, like how has the industry reacted to you doing this? Is it actually is it publicly known?
Mm.
Well,
Yeah.
I know it publicly is known because I'm a Bitcoiner, and
Yeah.
I will find
It's
out who's
the
got
sphere.
Bitcoin on the balance sheet, and I care about that. But I
Yeah.
imagine people within your industry, I don't do they care?
To be fair, not it's again, it's that thing of in our industry, the people that we work with are kind of, as well as being doctors who are in management positions, and that's something that we could go into for hours and hours. Is it correct or is it wrong that people with no management experience are in management positions, right, in the NHS, which is part of the reason why it's crumbling? But that's a whole other debate. Another part of the people is chief executives and people high up in the corporate positions in these hospitals and not-for-profit trusts, not-for-profit organizations have the contracts with the trusts. They're traditionally very conservative in the sense of you've got that old school mentality of, okay, I'm working, I'll invest in stocks and I'll put my money in something that's going to grow 8% a year, and growing 8% a year is effectively going to take me forward. And they're not looking at it from the same lens that we do, which is the real versus nominal problem, right? You can look at basically the returns from that viewpoint, but you're missing it from our viewpoint, which is actually no, you're standing still when the world's running forward from you, right? So it's intellectually, we're in the field where even if we mention it to someone, their initial thought point would be, well, is that legal, right? Is what you're doing legal? Are you allowed to do that? And what are the risks? And actually, why don't you just store it in cash? And there's that lack of understanding there. And until they come around to that thinking, which I feel like you could speak to them for a very, very long time, it would be futile, because the first thing is it doesn't necessarily change what you do with your contracts. So for us, we've not advertised to them that we've got it on a balance sheet. We've put it on Bitcoin Treasuries net just so that it's there, right? Because I just think it's interesting in terms of advocacy and getting the word out there that, there's a healthcare company that's got it on, right? But it's not something that's been publicly mentioned that, okay, this is a change in our business strategy. We're just effectively still operating the same way, but we've got it internally. We know what it is and we hold it.
How how did it so the board, or
Yeah.
four other members of the board, or
Yeah. Yeah. Yeah.
yeah, is that right?
Yeah.
Four of the members of the board, it turns out that they had Bitcoin already. So then it was that quite an easy conversation around, right, let's see if we can put this in our business. It sounds like you kind of had a Michael Saylor moment with the melting ice
Yeah.
cube. And it was like,
Yeah.
right, we've got cash here.
Yeah.
We all know what's happening here, but
Yeah.
we're not telling each other that we know,
Yeah. Yeah.
because we haven't told each other that we're into Bitcoin yet. And then, yeah, was it quite an easy decision to then implement that and try it within your business?
Yeah, funnily enough, the thing that took the longest was getting the actual business registered on the exchange, because the amount of questions they ask you for KYC was through the roof, right? And because the structure of the business was such that we've got limited shareholders in the limited company, they ask so many questions about each entity. That actually took longer than us coming to a consensus. Us coming to a consensus took a few WhatsApp messages, a couple of calls, and a face-to-face meeting. That's it, right? It was done within about like the space of a week and a half. And then actually executing that was frustrating because it took 2 or 3 months to get that approval from the regulatory side of things and then putting on the balance sheet. So finally, that's done now, and that's something that's in the past. But yeah, it was fairly quick, to be honest. And the only thing that we had to ensure was actually asking that question to say, okay, how are we going to do it so that it's not a risk to our NHS contract? How are we going to put Bitcoin on the balance sheet where it's not an excessive risk? And what are the things that we're going to adopt as a board in terms of the resolution to say, okay, if the price fluctuates X amount, this will trigger a review, not necessarily a sale, but just so that it's solidified in terms of the legal structure. So you can say, okay, at least there's some kind of risk mitigation strategy there that meets your criteria for saying you're a responsible company, really.
That's so interesting.
Yeah.
Because yeah, it reminds me of when I was investigating Bitcoin mining in Scotland at
Yeah.
wind farms. This
Yeah.
is totally like off topic, but you'll see why I'm doing this, or why I'm saying this. At wind farms, and talking to them, like the big ones that are getting the are getting curtailed. So
Yeah.
then they're getting paid for essentially not providing energy to the
Yeah.
grid.
Yeah.
And their biggest thing was, we don't want to do it because this risks us getting our payment from the government.
Yeah.
And that's like, that puts off so many people,
Oh, yeah.
that side of things. So it's good to hear that you've managed to work a way that is uh, that shows that you are managing this responsibly, and you're almost looking at it uh, or putting that system in place almost like a pension. On we will review it, and a pension would usually rebalance if
Yes.
they've got Bitcoin on there.
Yeah.
um, but having that mechanism or that review in place,
Yeah.
so then it can be or it can be
It can't be
queried. But
queried, yeah.
yeah, yeah,
Because in an ideal world, what are we? Where Bitcoin maxes, you believe that Bitcoin's going to be, well, Bitcoin is money. Bitcoin's the most perfect form of money ever created. In a perfect world, you hold it forever, right? But in the business world, especially in the line that we're in, we have to balance that with saying, okay, the appreciation. What's the appreciation going to enable us to do over the long term, in order to accelerate us faster than our companies in a similar stage? And at what stage do you decide to divest from it? Shock horror, right? In order to actually grow the business in another way, or do you hold it for the long term and just say, right, that's the thing that's outperforming everything? So this is just something that we just have to look at every year. But again, it's something that I don't see changing for the next 10 or 15 years, because you can just see hyper growth for the next 10 to 15 years. You see what that we're almost at an inflection point in the Bitcoin adoption story, right? Where you're looking at it thinking everything is falling into place. You know, it would have been very, very different, and it was a bit of it was kind of almost like a Wild Wild West 4 or 5 years ago, when you're still having the block wars and things, right? And you're sat there going through that, thinking, how's this going to work as a corporate entity if we're sat there all of a sudden one day Bitcoin forks into Bitcoin Cash, and we've got Bitcoin Cash in our balance sheet, and what do we do with that? And are we going to sell it? And you're sat there thinking these things can actually trigger legal and regulatory problems, especially in the UK, where there's, we're traditionally very, very slow versus America, right? Which is 4 or 5 years ahead of us in terms of how they've accepted it, right? Here, it's still almost viewed as a very, very fringe thing, which for us is very difficult to understand and grasp, because when you understand the kind of core nature of the problem, you just, this is the solution to everything. Every time you see a headline about Rachel Reeves doing something, you just think, you're a fool. What are you talking about? Like, this is the solution staring you in the face. And instead, just sat there reading headlines such as, the UK is considering selling its Bitcoin position because it's appreciated. And you're thinking, no, this is not how you go about it, right? But it's the regulatory landscape is going to change at some point, and it's just good to be ahead of the curve on that front with where we are, right? But again, being ahead of the curve is not, it means that we have to have the right reporting structures in place. We have to have our accountants on board. We have to have the right board resolutions. We have to have the reviews, so that just from an auditing perspective, if anything were to happen, it's like, well, look, this is how we've taken it and we've managed it seriously. So, for us, for people who don't understand it from a corporate point of view, it's very easy to say, well, just put it on your balance sheet and leave it there and put everything in it. But it's very different in the corporate world.
yeah. And
Yeah.
it's like, how important do you think it actually is? So I'm always like saying, like, well, that's what the Bitcoin Collective is now, is
Yeah.
helping businesses put Bitcoin on
Yeah.
the balance sheet. And like,
Yeah.
I'm always saying that every business needs that Bitcoin strategy
Yeah.
in place. But of course, you need to understand the problem, like you do,
Mm.
and your 4 board members as well. But like, going forward, like, just how important do you think it is for businesses to actually understand what this thing is, and like help them when you're talking about like this moment in time where regulation is so unclear, the
Yeah.
government that we've got, or just government in general, really.
Yeah. Yeah.
Yeah, at this moment in time, how important do you think that is to be actually looking at Bitcoin?
It is, if in my opinion, it is the most important thing that any business has to have, because effectively you're trying to build a business on foundations that are just, you're building a business on sand, right? Having a corporate strategy where you're saying, okay, we're a business that's making money. How do we keep the money? How do we make more money? Right? That is the aim of the
Yeah.
business. Whether people want to talk about it as taboo or not, actually, why do people have a business? Why do they open one? It's to generate a profit, and it's actually to also, through your business, is to kind of hopefully make a positive change in the world, right? That's what any business wants to achieve, those two goals. But the only way you can ever achieve those two is actually having a solid foundational financial structure. It's like building a pyramid without the blocks underneath. If you're looking at any pyramid, the most important thing is actually having that set in the bottom. So, you know, I use the same perspective in my GP practice. So I'll use an example, right? In my GP practice, there's a problem now, and this is going to sound insane, right? Where NHS practices across the UK are actually being chased by the NHS themselves to actually provide payments that are way more excessive than they should be for the terms of facilities management for their buildings. So, for example, we've got a building, and the building is worth, I don't know, 900,000, a million or something. We don't own it. We pay a lease to the NHS for the use of that health facility. The service management on that building is around about £100,000 a year, which is insane, right? And actually, when you break it down and you say, well, actually, what are the NHS charging us for? They're charging you like £1,000 a year for grit salt, and you're sat there thinking, we've not had the car park gritted in a year, 2 years, 3 years. How is it £1,000? They're charging us £1,500, £2,000 for cleaning the windows, and you're sat there thinking, what's going on here, right? So actually, lots of GP practices are in this. They're in this battle legally with the NHS to say you guys are charging us excessively for facilities management. And actually, in my practice, we've got £380,000 sat in the reserve waiting for this legal battle to come because we've had meetings with them, right? And you're sat there thinking this 380k has been sat there for 2 years, right? Now, all of a sudden, the cogs are whirring from the Bitcoin point of view, where you're thinking, well, what's the price of Bitcoin 2 years ago? What if I had Bitcoin on the balance sheet? Okay, we would have had 380,000 plus more left over. Why is that a problem in the GP practices? What's happening in GP practices in the UK are the government is effectively paying you less per year in terms of fiat inflation is going up by 7-8% a year. We know maybe even 10% a year, right? Because we know the metrics are flawed, CPI and RPI and whatever you want to use, right? On top of that, they're saying we're actually going to give you an uplift of only about 2 or 3% per year, but you have to pay your staff 6 to 7% more a year because that's what the DDRB and all of the pay recommendations are saying, right? So all of a sudden, every single year, you're left saying we have to cut 1 or 2 members of staff because we can't afford it, because our contract's not going up in value, and because the facilities management's going up in value, and because the rent's going up. Yet we're still managed to manage we're still expected to manage a population of 10 to 12,000 people, look after their chronic disease and their health, right? So everything is just breaking from the seams. And you're sat there thinking, well, if you don't have solid, stable financial foundations, how are you ever going to achieve that? So the maths is very simple. If you presented it on a black and white scale, you say, well, okay, 380k 2 years ago, how much would they have bought you in Bitcoin? You'd have 380k plus 380 or 500k left over, right? What does that mean? That means that we can employ more nurses, we can employ more doctors, we can actually advertise, and we can bid for other services. We can provide better services for our patients. So actually, it's an effect where everyone is benefiting. It's an effect where your patients you've got the effect of your consumers. You know, people who turn into your business for help are actually getting better help because your business is managed, in a more stable way. I mentioned it to a couple of my partners, but they're not as forward thinking on this. And GP practices are very, very traditionally kind of how they manage that kind of position. It's just not something that's been considered, which is frustrating because you look at it from my point of view, thinking this is the solution, right? And the same applies across industries. For different industries, it'll be exactly the same. What's the problem? What's the problem with how businesses are run? It's actually you read the headlines year in, year out, and it's X firm cuts X amount of jobs. Why can't they afford to keep these people on, right? Well, purely the reason is inflation is ravaging everything in society. Everything's costing more. You can't pay the wages, therefore you can't employ the staff. But then the quality of services from businesses is also going down as well. So it's a problem, isn't it?
It's a big problem. And it's
Yeah.
like we're at that point where it's like it's becoming a lot more clear now to I think people in society that there is actually a massive problem here.
Oh yeah.
And the inefficiencies as well within government are becoming a lot more clear. And like when you're talking about the facility management costs going up, I was just I've just picturing. I don't know if you've seen over the past few weeks, there's been a video circling social media from Jay from the In-Betweeners.
Oh
Do you
yeah,
know?
I've seen that. I
Have
saw
you
that
seen
video like
that?
2, 3 days ago, and
Okay.
yeah, it's true, right? Is that they're thinking how are they making us pay more council tax, right?
Yeah.
When they're making us pay for something we're already paying for, and they're using
Yeah.
a different name for it. It's just shit. It's just it's obscene, isn't it?
It's crazy. And like for context, for people listening, that Jay from the In-Betweens, I don't know his actual name, but he does a podcast with his wife. And he just went on an absolute rager. Uh, you could see his wife just being like, oh God. And he was like, well, what was he saying? He was like, our council tax is going up in price, but
Yeah,
yet they're not picking up our bins as often. But then
yeah,
they've just asked him, wherever he's living,
yeah,
to then pay to get a certain
yeah,
bin picked up. And he
yeah,
was like, but our council tax is going up. What are we actually paying for if you're then asking for something else on top of this?
yeah.
And I thought that really summed it up. And the fact that it went viral as well kind of shows that other people can relate to this.
Everybody understands that, and the thing is, it's not even just that aspect that's been broken, right? It's trickled down on everything. So from my point of view, I see it day in, day out when I've got my doctor hat on and I'm seeing patients. It's just got worse over the last 4 or 5 years. Everything has got worse in terms of. I remember 4 or 5 years ago when I was seeing patients, looking now versus then, how many patients are coming in depressed? How many people are coming in stressed? How many people are sick from work? How many people are not managing chronic disease? And how many young people are getting diagnosed with chronic disease you wouldn't expect? It's skyrocketing, and I'm alarmed. I'm seeing people in my clinic who are 29 years old being diagnosed with blood pressure. How are you being diagnosed with blood pressure at 29 years old? Right? Either we're not diagnosing you properly, and then obviously that's the first thing you look at, and you think, okay, make sure it's accurate, and it is, and you're thinking, what's going on here, right? And everybody's seen those charts who's in the sphere that we're in, which is, what the F happened in 1971, right? You
Yeah.
know, you take away, you have to look at it from, there's two things that have impacted healthcare in the most, right? The first thing is how money has actually it's effectively infected the way in which people live their lives, right? So you have the picture, everybody's seen the pictures in the 1950s and 60s in America of a guy turning home in a suit with his jacket like this, and a wife and kids greeting him at home, and the Chevy parked in the drive, and he's eating like 3 eggs in the morning for breakfast. Everybody's seen that, right? That was the American dream. It's also the dream here, right? Everyone wants to be prosperous. You're sat there thinking we've gone from societies where one person works, they can afford as many holidays as they reasonably want, they've got a car, they've got a nice house, it's done. They've got a pension, right? And they stop working at 50, 55, and that's it, right? They pass it on to their kids. There's no problem with inheritance tax, which in this country is crazy, right? It's been mad for the last 2, 3 years. And you're sat there thinking, how have we gone from that to two people working, not looking after their children? They've seen their children maybe 2 hours a day because they go to nursery and they're at work, both of them. You're having an increase in divorce rates. You're then having single family homes where effectively the effect is worsened. You're having chronic disease. You're having people who are obese, stressed, and depressed. And what's the other factor? The other factor is how money has actually affected the food system, right? So we'll all go into a supermarket, and I challenge you to go into or even a small supermarket, like a small 7-Eleven in America. I call it Tesco Express, whatever, right? How many things are from the ground? How many things are natural, right? There's one section where there's a fruit, there's milk, and there's cheese, right? And maybe there's meat. What else is there? Every single other thing is just made at a factory, right? It's packaged and it's processed and it's got an expiry date. That just seems too good to be true. How can something be made for human consumption last 7 to 12 months on the shelf? It doesn't make sense, right? You're sat there looking at that thinking, well, actually, from the foundational perspective of the food pyramid, that's upside down as well. Gaslighting goes into saying that no, you shouldn't be eating meat and you shouldn't be having full fat milk, and instead you should be having refined grains and stuff with soy and starch things in it, right? And you're sat there thinking this is not healthy. You're matching the two together, and you're saying how has heart disease gone from being the 50th on the list of killers all the way to number one in the space of about 70 years, right? How has that happened? How's it linked? It doesn't take a genius to figure out it's to do with this, right? Especially the rates of diabetes. I get people, I'm diabetes lead in my practice. I get people come in all day, and they come in and I call them see me specifically because their sugars are skyrocketing. And I say, look, book an appointment with me and let me chat with them and see what's going on. So I ask them, what's going on? What are you doing with your diet? I followed the NHS guidance doc. I've had to cut my eggs and my meat because they were telling me my cholesterol was high. They put me on a statin because my cholesterol was high. Even though no one in my family has died of heart disease, they're basing it on a number, right? Which is controversial. And they're telling me that you can have these diabetic fat-free snacks, as long as it doesn't have sugar in. If it's got sweetener in, and you don't have full fat yogurt, don't have full fat dairy. And what are you eating? How often are you eating? The pattern's chaotic. It doesn't make sense. And you're like, well, your sugars are up for a reason, right? So how many of those have I taught to go on a keto/carnivore type diet for like 2 months have come back to me with higher sugars? None of them. Every single one of them has got better sugars and better weight, right? So we're looking at it from a first principles. I look at healthcare from a first principles lens. Bitcoin teaches you that, right? Prior to
Yeah.
this, I didn't know what first principles was. I had no idea, right? And then you understand from reading that Safety Dean's book and all the other resources that from you have to look at everything in the world from a first principles lens in order for it to make sense. You have to question why in everything, right? So many people come in and the appointments will last 30 minutes instead of 10 minutes. And I've got people waiting in the waiting room. It doesn't really matter because it's important for that patient, right? And you're going through the education process and you can see the light bulb moments in some patients who truly understand it. And they say, oh, right, I never knew that, doc. And, they told me that this was good for me. I said, it's not. Try this and see what happens. And you follow them up and the impacts on their health are amazing, right? How many people start to lose weight and how many people get less joint pain and less depression and, they're more fit. So, fiat money's corrupted the way in which we approach these two aspects of our lives, and that's what's breaking the healthcare system, as well as chronic underfunding. We can talk about that as long as you want. It's not just the underfunding; it's actually what's happening to people's health and how many people are presenting with what we call multimorbid disease, where one thing leads to another. They become obese because they're obese. They get blood pressure because they've got blood pressure. They got high cholesterol or an increased risk, which makes them get put on statins, even if their cholesterol is low, which is another thing we'll talk about later. But it's crazy. And then they become diabetic, and then they become depressed. They can't work, and then they're on sick. So, actually, how do you stop that cycle? You don't start from the sick note. You start from the foundation, your principles, right?
Yeah. It's
Yeah,
it it's so interesting. I love this link between like the money and health. Because not many people actually can make that link. Unless you've actually understood like what is money and like how
yeah,
that's broken.
yeah,
But then how does that actually go through society?
yeah,
And it's I think like Joe's video, Joe Bryan,
yeah, yeah,
what's the problem? I think that like outlines it really well
yeah,
with how what broken money can actually do to a society. And you're right, it's people not going far enough back down to the
yeah,
base layer and
yeah,
figuring out that this is actually a thing that's causing this. Because, like, I think on a
mm,
podcast, one of the last podcasts I did, we talked about the centralization of food
yeah,
as well. And it was actually on Paula's podcast. I was on hers,
yeah,
and
yeah,
uh, yeah, we talked about the centralization of food and like the problem with that as well. And I was talking about, or I've learned a lot around it when it comes to like Jeremy Clarkson's,
oh yeah, yeah, yeah.
yeah. So like, and I realized that's not like a potentially a good way to be educated around something. I'm just referencing like
It's just that.
An Amazon Prime, but you do see this, and then I see everything else that people are complaining about because I'm not well versed in the
Yeah,
UK farming essentially,
yeah,
but I can see that there is elements of centralization within farming, which then like that
yeah.
then affects the quality of food that's getting put on the shelves, and then
Yeah,
that affects people's health, like you're saying.
massively, massive. And I think anybody who says that this is make believe, they're gaslighting you, man. Like this kind of stuff. It's the more you read into it, the more you understand it, right? When I've looked at the papers, I've looked at the research, I've looked at things like the Minnesota coronary experiment, which only managed to get published. How many years after the death of Ansel Keys, who was the guy that came up with the nutrition guidelines, right? Who was effectively on a one-man mission to say meat is bad, and we're going to get people to not eat meat and be vegetarian. I think it was his son that the researcher went to actually say, look, we've heard about this study. It was one of the most popular studies in terms of media coverage, but the results never got published. Why was that? And they effectively, it was the largest study done on a controlled population, because nowadays, ethically, you can't do these studies anymore. Back then, 50, 60 years ago, ethically, you could basically lock people up or have them in prison and say, we're force feeding you this and we're force feeding you that, and we're going to see what's going to happen to you. Ethically, now that can't happen. So that means that actually the studies that you do now are not as controlled as the studies you could do back then, right? Which is a bit of a paradox, because you don't want to go back there, but actually the studies were more robust, right? So actually, when they pulled out the study results, it's alarming. So if anyone is watching this, just look it up, the Minnesota coronary experiment, right? The research actually showed that they were looking at the rates of when people ate meat versus when they didn't eat meat, how many of them would have coronary events, right? And they actually found that there was no link between it. So the people that actually ate meat, as far as mine, they had lower rates. So I think they looked at blood work, they looked at cholesterol levels, and they found that cholesterol levels were higher in the meat eaters, but then the cholesterol levels were not directly linked to cardiac events, which is then it blows a hole in your conventional line of thinking, right? Which is in the UK especially, we're sat here looking at people saying your cholesterol's high, you need to go on a statin, knowing nothing about them. I remember having a guy come to me once, and his cholesterol level was high. We called him in, and there's a guy that trains 4 or 5 times a week. That he has like a semi-carnivore type diet, and he's physically fit, running marathons, right? And you're like, my cholesterol's 7.6. The guy says give him a statin. I'm not giving you a statin. What am I going to give you cholesterol meds for? Right? You're fit, right? And you're sat there thinking, this goes to the heart of the problem, which is lots of medical and nutrition guidelines are based on these things which have not been changed in 50, 60 years. You go and look at the food pyramid. It was from that period of the 60s and 70s when actually the data was very, very flawed and nothing has changed. So when you go in the supermarket and you look at basically say, okay, what's green, what's red, and what's orange, there's 2 problems with that. The first is what's green, red, and orange. They're telling you the wrong things are bad for you. Yeah. And the second thing is by doing that, you're obviously eating the wrong kind of foods and getting the wrong results. And you're left perplexed thinking, well, why am I not losing weight? Or why am I in a chronically inflamed state when I'm eating what's good for me? Right. So really interesting.
So like, I love this connection between, money and like health, and like, because health is a big problem that we're having. And then NHS under massive strain from multiple different reasons that we've kind of alluded to and we've talked about.
Yeah.
So I think it's really important. I'm going to bring this back to the business side of things. I think it's really important to have people like yourself and other people like pushing things forward and actually coming at it from first principles and looking at like, okay, well, the world is moving. How do we move with it? Rather than just being, okay, let's just stick to the status quo. Because you could easily do that. You can stick to the status quo. But it's like, okay, well, let's actually try and push things forward. And I want to bring in something that you've done recently around using AI as well. Because we are in a time of Bitcoin and we're in a time of like AI advancement that is just insane. Like the amount that it's come on over the past like 4 or 5 years.
Oh, yeah.
So can you talk a little bit about like, so you've built something called My Doctor, but there's a story behind it.
There's a story,
I'll leave you to do that.
It's a very long story. It's a very interesting story. So long story short, before we come on to the prelude to it, is look, I've always been a guy that's been very, very interested just generally in technology. I was the kind of guy, like everyone had Blackberries back in the day. I'd have an iPhone 4 and I'd jailbreak it. Okay, I'd go, I'd go.
Nice. I did the same.
I'd read all the tech blogs. Then I switched from iPhone to Android and had look, open source versus closed source. Looking at that kind of thing in terms of technology and also devices and human behavior, right? So I've always looked into everything in terms of my studies and stuff. My interest in beyond medicine, which lots of doctors will just read about medicine and nothing else, and their life is consumed by it. Mine's a little bit different. I've always been interested in reading lots of different kind of things, the history of technology and human behavior and psychology and technology, right? And the first time I kind of came across the line of thinking in terms of like where are we with regards to technology was I was reading a book and it was just talking. It was actually Michael Saylor's book, The Mobile Wave, right? It was talking
Great
about,
book.
and this was a really interesting book because it's talking about actually how the waves of technology are changing in terms of human behavior, how it interacts with each other, right? And what you can start to extrapolate from that, even if the conclusions weren't in that book. Where are we going? And what's going to happen to the world, right? So everything starts with email in the 70s. In the 70s, you've got this email protocol that allows one machine to communicate with another machine, and the users look at it and say, well, there's a message that's been sent to me and I need to do something with it, right? Back when computers look like the Matrix, where it's all black and green, right? And then all of a sudden, the advent of the internet came in the 90s and the 2000s, which enabled you to do other things, right? So everything that we thought we were advanced with, we actually realized that we were very primitive, right? So for example, we used to search numbers in the yellow pages. We used to look at maps, right? You used to pull out the road map. Your dad used to pull outside the road and pull up the road map and say, where are we? We lost it, what we doing, right? And all of a sudden, the internet comes along and you can search whatever you want at the palm of your hand. Wikipedia comes and completely obsoletes encyclopedias, right? Amazon comes and replaces retail stores. Then all of a sudden the iPhone comes in, and the iPhone it makes a PC into a different kind of PC. It makes a personal computer into a portable computer, right? Which is a rapid shift in what the humans can do with one another, right? So all of a sudden you go from being able to do that on a fixed device to a device where you can move. And that's transformational for 7 to 8 billion people in the world who can interact on these devices now, right? So the next thing that came along was certain things like Spotify and the iPod, which kind of it dematerialized MP3s. It dematerialized stereos into MP3s, right? So no one walks around with MP3 players anymore. You don't have a Walkman, you've got your phone on you, right? Or if you've got a Tesla or something, it's in your car, right? Which is crazy. Then the next thing you think about is how Bitcoin has come around, and it's dematerializing finance. So what you envisaged was going to happen in the next kind of 10 or 15 years at least is Western Union is not going to exist anymore. Right now it does, but we know it's not going to exist when people can transact, in a global currency that's permissionless, that's borderless, that's instant, right? That doesn't have markup fees. People are going to use a Lightning Network for transferring value from one person to another, right? We know that's going to happen, right? And the next thing that's come along is AI, and AI is rapidly, and it seems as though these waves are happening faster and faster. We all look at waves of adoption, for example, of that. We look at the charts of like Amazon and the internet and Bitcoin. We've seen those charts, the S curve of adoption, right? And it almost seems like AI is coming and it's just obliterated that as well. And you're looking at what is the purpose of AI? AI is dematerializing workflows. So traditionally, and this is where it comes into our business as well. Traditionally, what would have taken you years and years and months and lots of capital to do something is now done at a fraction of the cost with an AI bot that's working for you 24/7 whenever you feel like it, right? You can't sleep in the middle of the night. You wake up, you interrupt the AI agent, it's doing work for you. Whereas your personal assistant is sleeping in bed till 9 o'clock or is calling in sick, right? You can't actually, you can't, you can't put a price on that. So what we did was we were looking at how could we a pipe dream of ours has always been to build like an app where people can interact with our services. So it's a private consulting service. You can actually go on the app, book an appointment, request a prescription, or also then do additional things that we wouldn't be able to do. So if you want to track your height and weight, you want to track your macros at the barcode scanner, you put your medication in as a reminder, you want to talk to an AI agent which says, okay, are you having side effects that could be related to your medication? You can have a conversation with it within the app. X, Y, and Z, and further other features, etc. Right? It can get really boring and really techy if we go into it, so I'll stay away from it. And I thought, okay, how can we do this, right? So one of our long-term plans, actually, when I came on board, was within the next 5 years, build an app. Okay, so that was like 2 years ago, and I came across this thing called Replit on the internet, which is a no-code AI agent. And I remember just interacting with it, and I just start putting in prompts, and all of a sudden, I'm like, this app is being built within the space of like 2 days, man. I'm like, what's going on here? This is crazy, right? And everything is functioning. And you're sat there thinking, look, this is wild. I remember the CEO posted a video on YouTube, and I just commented underneath it, and he took a screenshot of the comment and posted it. And all of a sudden, my Twitter just blew up, and I was like, what the heck's going on here, right? And then his team reached out to me. We did some features in online. It's really interesting, and they were blown away by it. Thinking, look, you've never coded in your life, and you've built an app that's got all this stuff integrated, right? And it's functional. How does that work? So all of a sudden we're going into a world where you don't need technical expertise in order to interact with a machine and in order for the machine to interact with other people, right? So the thing that's always limited humans is effectively you've gone from a place where you are interacting with the machine, someone else has to interact with it, and there's an intermediary or there's some kind of delay. But we're now shifting into a world whereby we're effectively going to have machine-to-machine interaction, which is going to overtake the world, right? It's fascinating. It's really interesting. It's just something that I came across. And when you think about Bitcoin, where does Bitcoin fit, right? You've got an unwritten law in history, which is effectively, if you have people who are in a closed system, all other things equal, would they shift to an open system, right? And you could think about that in any line of the world, whether it's finance, whether it's politics, whether it's where you want to live, whether it's whether it's you going from a monarchy to a democracy, for example. If you ask people the very basic premise, which is you are going to switch from a system which is closed, which is limiting your ability to do something, which is effectively not allowing you to have control over your money or your freedom, and then you're going to a system that is permissionless, borderless, instant, and then you've got an AI agent that's working 24/7 that's going to enable people to do things and interact. What's going to be the currency of the internet and the currency of AI agents is Bitcoin, right? Jordy Visser, you might have heard of him. He comes on the Pomp podcast and he's got a Substack. He talks about this, and it's really, really interesting. If your listeners don't have it, I'd say subscribe to Substack because it's fascinating. And he talks about it, and he says, look, the rapid kind of shift in technology with AI agents is actually going to link into Bitcoin, and they're both going to slingshot each other into the future. I mean, if you've got an AI agent who's working for you and it needs to validate something on the other side, one way that you can validate it is with a microtransaction, right? So what's a real bot and what's a fake bot, right? Are you on the Bitcoin network? Are you on the Lightning network, right? It makes sense, doesn't it?
Yeah. The convergence of Bitcoin and AI is so interesting. I done a episode on that with a guy called Krok, and he's a professor at Texas University, and that's literally what he runs a Bitcoin course, techie side of things, but also he's big into AI and like the convergence of the two, and he was saying exactly the same. That it just makes logical sense for the currency for these agents, these AI agents, to be Bitcoin. And it's all about like being able to then harness that. Because I think that's the important thing of like, it is all out there, but it's like having that want to go out and actually, how do I use this? Because like once you implement it into your business, like we run AI through quite a lot of stuff in our business, and it just makes it way more efficient in the things that you can do. And once you can harness that and use the power of that, like it just frees up your time to then continue building your business, which is like amazing thing.
It is. It's incredible. And I think there's so many facets to it. But the one thing that I find interesting is now that you set the scene, we set the scene, right? Okay. I say this in medicine as well, and I say this in technology too, right? And I've actually had a lot of backlash from this, and I don't understand why, but maybe if you had a traditional mindset, you would, right? And I'll use an example, right, in medicine and in technology as well, okay? So the example of medicine, where are we, right? I always look at where we are now, and I say, well, what would people in 1 or 2 or 300 years look back at us and say that we were doing that was stupid, and would they laugh at us, right? So if you look at pictures in the 1600s, when the plague was ravaging, right, you had these doctors who were dressed like ravens with like these massive sticks, right? And they're like, well, this is going to protect us from the plague, right? So when the doctor came to visit you and knock on your door, they have this massive outfit on, which is like a massive, like a raven beak and like a big, like, Grim Reaper stick, right? And we look back at that and we laugh and we think, what on earth are they doing, right? But back in the day, people would have had respect for that doctor saying, this guy's going to save me. He's my savior, right? So I remember putting something out online and I said, look, we're looking at all of these things. We're managing chronic disease. And we're saying to people, we have these tests, such as your blood work and your scans, and they've not showed a problem with you. Therefore, everything is normal, right? But the person is sat there still suffering from symptoms. And we have to ask ourselves, why has that person still got symptoms? Is it so crazy for me to say, actually, there's an undiagnosed disease there that our testing has not been able to pick up? Or is it, no, you're the crazy one and there's nothing wrong with you, mate, right? So I look at it and I say, well, it's far more likely it's a combination of the two. But to completely discount the fact that we don't yet have the technology to be able to say that you've definitively not got anything wrong with you, it's wrong to think that. And I had a lot of backlash from people saying, oh, what are you talking about? And, we've got so many studies going on and this and that. And I say, well, it doesn't make sense to me, right? And the second thing, technology as well. Where are we in technology? So, for example, you look at something as simple as email, right? in the 70s, email comes out, and human to machine interaction is going to rapidly change. Whether people foresee it or not, it will happen, right? So right now, we think that emails are a normal or natural way of conversing with each other online because we've been doing it our whole lives, right? But we've seen the evolution of email as well, right? So at the moment, I call it a dumb system. I send you an email to say, Jordan, let's have a meeting with regards to a podcast, right? Here's an attachment I want you to read before the podcast. It broadcasts a message and it gets sent to you, right? But you still have to do something with that message, right? You have to read it. You have to process it. You have to click the attachment. You have to open it. You have to decide what to respond. You have to respond. If you actually think about the way the world is going, that's a very, very primitive way of interacting with a machine, right? You should actually have an algorithm in the middle that says, well, Fahim is sending this message to Jordan. This is what he wants to say. This is the expected outcome from the email that Jordan is going to receive. This is what we want to project to Jordan. This is what we want you to do, right? So instead of you having to take a manual action from the email, it become automatic, right? So that's one example, but that's going to change in technology massively. So AI agents is massively going to drive that shift. Someone is at some point in Silicon Valley is either going to steal this idea and become a multi-billionaire, or has already come up with it, or is doing it right now, and is going to say, right, we're going to have a protocol that's going to replace email. And the only barrier to that is that the system is so entrenched in it. But again, you go from this closed to open system argument where you say you're in a closed system and the constraints are the system that you're working in, or you have an open system which has got AI agents working in it, which is effectively enabling you to do more and free up your time. Which one are you going to choose? You're going to choose the latter, right? So all things equal, we're going to shift towards a world that's massively different from where we are. But Bitcoin is going to play a massive role in that. Yeah.
Yeah, the only constant is change. And like,
Yeah.
I have so honestly, I could talk to you for hours on this. Like, we've got a whole other hour that we could do, but we're not going to do. But
Yeah.
I'm going to make 2 points around this. Is like, one, like it was so normal for such a long time to say, "Oh, I'm going to Google something," and I always say, like, that's probably not going to be the thing in case or the thing in the future. But people are like, "Oh no, well, that's just the norm." And like, I use ChatGPT more than I use Google now, because there's so much friction
It's
when
so
you're
much easier. Yeah.
when you're trying to look for something. You need to type it in, and then you need to look through thousands. Well, there is like millions of search results.
Yeah.
And you need to find the perfect one, click on that, scroll down, read through all the shit. And it's like, it's very difficult. And then another one I want to make, just because I think very similar to this.
Yeah.
And I had an argument, or I do reoccurring argument, or debate, I should say, with a friend of mine. And I say, like, I don't think we're going to use planes that much in the future. Because like, if I want to get to Australia, it takes me 24 hours. And how inefficient is that?
Yeah.
And he's very much in the camp of, no, they're going to be, this is how it is. This is how it's going to be.
It's going to change, right?
Yeah. And I was like, well, look what's happening. We've got rockets now that are going up into the outer atmosphere. They can go 248,000 kilometers an hour once they're up there.
They'll get you there in like an hour. Yeah.
In an hour, exactly. Yeah. And they're already testing it. So, well, I eventually won that debate.
It's definitely going to happen. It's going to happen. Yeah, it might not be it's not going to be in our lifetime. It might not be. It might be in 500-600 years. But are you telling me that's not going to happen? Of course, it's going to happen.
Yeah, exactly. Oh man, we could have just get going.
We'll go from medicine to something else.
I love it. This is what happens when you're into Bitcoin and you're like actually just looking to the future. That's all it really is. Looking at what we've currently got, looking what might be in the future. But honestly, Fahim, I loved having you on and like having this conversation. And I will put all the links to everything that we've just talked about down below, so people can click on them, find you, reach out to you if they want to follow you. But it was awesome to have you on, man.
Yeah, no, thanks for having me. Really enjoyed the chat. And to be fair, we actually spoke about a lot more than we did last time, which is great.
Awesome, man.